Hello viewers, welcome to our Facebook live session. Today we have with us our specialist, Dr. Amit Langote, consultant nephrologist and kidney transplant physician at Apollo Hospitals, Navi Mumbai. Today, in this live session, we'll be discussing on ways to prevent kidney stone. Welcome to our live session, doctor.
Hi.
The first question is, when we hear about kidney stone, is what is a kidney stone? So can you explain?
Okay. So basically, all of you know what a stone is. So kidney stone is also a stone, except that the composition of the stone is certain chemicals that are excreted or secreted in the urine in more than normal quantities, and then they saturate together and then they precipitate and form a stone. So it is like any other stone that you would know, but they vary in the hardness based on the contents of the stone. Some stones are smaller and some tend to become bigger. Most of them form a stone around a calcium nidus. So they are pretty much like other stones, and the color as well as the sizes may vary.
So doctor, how common are kidney stones?
Right. So various studies available across the country and across the world, and the incidence varies from each study, but anywhere from 1% to 15% is the incidence of a stone formation in a lifetime of a person. And if there is a family history of stone disease, then you probably have higher chances of forming stones than somebody who does not have a stone disease. If you form a stone once, then probably a chance of forming another stone in the next 5 years could be anywhere from 30 to 50%. So yeah, it is not an uncommon thing to have, really. Yeah.
What are the symptoms of a kidney stone?
Kidney stones can be either asymptomatic to cause severe pain. So the symptoms may vary. Certain times the stone could be small, but as it moves from the kidney down into the ureter and the bladder, it may have small spicules. Those are akin to a thorn, and as it moves down, it can cause severe pain. The pain would be anywhere in your lower belly to your groin to a tip of your penis or the tip of vagina, or there could be bleeding because the stone causes some internal injuries. Certain times there could be pain in the back or the flanks because of a large stone or because a stone causes obstruction to the urine passage. It could lead to secondary infections with fever and worsening pain. And the pain is sometimes so severe that you could have nausea and vomiting as well. Having said that, it is not uncommon to have a very large stone which obstructs the upper urinary passage, and the patient has no symptoms, and the first presentation is a totally damaged kidney and a large stone obstructing the passage. It's called typically a staghorn because it grows along the urine passage into the kidneys, and that's why it obstructs the entire kidney flow. And many times the kidneys are permanently and completely damaged when they first present, and they have no symptoms actually.
So doctor, how are the kidney stones diagnosed?
If you have no symptoms, then obviously it becomes very difficult for a person to seek medical attention, and hence they remain undiagnosed, and therefore they present with a permanent kidney failure or an end-stage kidney failure of that particular side where the stone is lodged. But if you have symptoms of stones which include what we mentioned, then a typical first examination includes an ultrasonography of the kidney, which will detect smaller stones to large size stones. Obviously, large stones are easier to pick up. We do X-ray as well, but there are certain stones which will not be visible on X-rays. The problem with ultrasonography sometimes is that the small stones may be missed because there is a lot of gas sometimes in your belly which may obscure a proper good view to a sonologist. So if you have a strong suspicion and if you see certain stones which do not explain your symptoms, then ideally we do a plain CT scan of your kidney, urinary bladder, and that will pick up every possible stone which is present in that area, also those which may have been missed out on a sonography. So if there is a plan for surgery for a stone disease, then we definitely do a CT scan to avoid any surprises during the surgery or to avoid any missing stones which we may not have found out, which we can tackle at the same sitting.
So doctor, why is it important or it's necessary to examine the contents of the kidney stone?
Right. So most of the people out there would be aware that stones are commonly form of calcium. But calcium is not necessarily the culprit all the time. The calcium may get deposited on something else which is acting as a nidus. It could be an oxalate, it could be a phosphate, there are various other types of stone. So giving content of the stone or knowing the content of the stone by various tests would actually allow us to look at other things that are present in the stone besides the calcium, which act as a nidus on which a calcium deposits. And then if it is an oxalate, then we can give you appropriate dietary guidelines or look at whether this is a genetic problem of oxalate and thereby treat you for that and prevent further stone formation. Without exactly knowing what stone is formed, sometimes you may not be able to get complete treatment, but general precautions can still be advised. So it's good to know what kind of stone, so you can specifically direct your treatment to that particular stone. Say example, it is a uric acid stone. Simple dietary measures as well as a tablet could help prevent the uric acid stone in future.
So doctor, as the topic suggests, ways to prevent kidney stone, can you give us some enlightenment on that?
Right. So there are certain measures which are specific to the problem that a person may have, but there are definitely general measures which everybody can employ to prevent stones. Especially if you have had a stone or if there is a family history of stone. Here are certain few things that you should follow. First and foremost, reduce dietary salt intake. And everybody says we eat less salt, we eat this salt, we eat that salt. Salt is salt as far as we are concerned. And let me tell you that Indian's diet is high in salt. So if you say I just eat what is in my diet, you're still probably taking a lot more than you should for preventing a kidney stone. So that's something that you can work on. Number 2, drink plenty of water. At least pass 2 to 2.5 liters of urine every day. So you should probably take 3 to 3.5 liters or 4 liters of water every single day. This is one intervention that has definitely proven to reduce the chance of stone formation by more than 90%, and which is completely free. So this is something that is in your hand, doesn't cost you to drink water. However, you cannot drink 2 liters in the morning and 2 liters at night. You have to space the drinking of water. You have to keep drinking throughout the day and not just drink because somebody told you to drink 4 liters. So don't drink 2 liters upfront and the rest of the day is a dry day. No, that doesn't help. What you have to do is keep drinking, so you keep passing urine frequently through the day. As you pass urine, don't hold urine for long periods of hours, because when you hold urine for 6-7 hours, you allow the chemicals in the urine to settle down and then form a complex which becomes a nidus for stone formation. So frequent voiding of urine is equally important, not just drinking of water. The third part is avoid non-vegetarian food, especially red meats, because they tend to promote stone formation and change the composition of your urine. So that is one thing that you can work on. Another common cause that we find why a stone forms is deficiency of citrate in the urine. And where does this citrate come from? Citrate is an inhibitor of stone formation. This citrate comes from citrus fruits in your diet. So increased consumption of citrus fruits like pineapples, lemons, mosambis, those things will help inhibit stone formation. Besides these, then you will have to look at what the composition of your stone is. And if you have a specific cause like a uric acid stone or an oxalate stone, then your diet can be appropriately tailored to reduce the excretion of these elements in the urine and prevent the stone formation. So without knowing, we can generally follow the 4 or 5 things that I said. Less salt, more water, frequent voiding of urine, less non-vegetarian protein, especially red meats, and increased dietary citrus proteins. These things should certainly help you reduce a stone formation or a recurrence by at least 90 to 95%.
We come to the last question, doctor. So how are kidney stones treated, or we can say what surgeries can be done to treat kidney stones?
Right. So there is a misconception among people that all stones will pass out. So let me tell you one thing. We have a tube, which is the ureter that comes down from the kidney, a tube that comes down which takes the urine from the kidney into the bladder. The tube diameter is about 6 to 7 millimeters. And the tube is elastic in nature. So if you expand and release the tube, it just collapses back. It's just like a socks. If you put a ball into a socks, it doesn't go to the bottom of the socks, because the socks, because of the elastic nature, will hold the ball where it is. So the tubes also tend to hold the stone as it comes down. If the stone is less than 6 millimeter or 7 millimeter, because the diameter is about 6 to 7, it has a good chance of passing down along into the bladder. Also remember, there are certain areas along the passage which are further narrower than the 6-7 millimeter part because of anatomical variation. So if you have a stone, say 1 centimeter, and it is in the tube, if it is along the width of the tube, then it expands more than the diameter of the tube. So the tube is going to hold it back. But assume that this is the tube and the stone is 1 centimeter this way along the length of the tube, then the stone will pass down. So not only this size, but the orientation of the stone will also allow the stone to either be held there or pass down. So that's why some people feel that, my stone or my relative's stone went down, it passed out, it was bigger than what you are telling. But it all depends on the anatomy and the orientation of the stone. That's one aspect to remember. Then whether the stone is inside the kidney, inside the urine passage, that's the ureter, or in the bladder. If you determine, or if your doctor determines that this is a stone that is obstructed and it needs to be removed, then normally the simplest form of surgery that we have available is go through the urine passage. We, especially at Apollo, have flexible scopes which can go into the small nooks and corner, and they can bend along the curvatures of the tube and get into the kidney as well as inside the kidney. And then we can break the stone with a laser and then take down the fragments and then leave a tube inside. So if there are certain fragments which have gone into the kidney, then those will not obstruct again as they come down. So that's what we call as a laser surgery to break the stone, and then we leave a tube that allows a continuous passage of urine drainage. This tube is then taken out after 3-4 weeks when all the passages have passed out. If the stones are bigger, and depending on certain situations, we may also employ external shock wave therapy to break the stones and then take the stones in bits and pieces out. So these are the two main types of surgery that are currently done for stone diseases.
Thank you, doctor, for joining this session. Dear viewers, if you have any question related to this topic, please drop your questions in the comment box and we'll address it to Dr. Amit. Thank you.
Thank you.